Joining me now to have a look on the patient perspective are Thorsten Bach, the EAU's patient information consultant, and Sunny Nalavenkata from Sydney University. Welcome to both of you.
Hi.
Thank you.
Thorsten, the EAU started 4 years ago, a new role, the patient information consultant. Can you tell me a little bit more about what you're exactly doing and why this is so important?
Yes, actually we started this patient information project, which I'm working with, and for exactly the same reason. When you as a patient, you get a diagnosis, a lot of our patients go into the internet and try to catch up some information about their disease. And when you look there, you find a lot of unreliable, biased information, a lot of people who try to sell you something and try to earn money with your disease. So we figured out what we need is guideline-based, unbiased, reliable information for our urological patients to enable them to understand not only their disease, but also when talking to the doctor to ask the right question.
What would happen if patients are ill-informed?
Of course they can rely on their doctors, but it's really important as a patient to understand your condition and to understand the treatment course. But because in this treatment course, there are certain moments where you probably take a wrong decision which will cause complications just because you don't know better. And it's very important to raise the level of education and information in our patients to solve this problem.
Sunny, what are you undertaking to better engage and inform patients? There's a study you've been doing?
When we looked into the factors that led to patients being misinformed, we found that a lot of it was dependent on the physician and how much time they have available, their skills in training with communication, also patient factors such as their language, their background, their educational level, all have played an impact in how much they understood from their consultation. Often in a busy environment such as the emergency department, they found that they wouldn't have enough time to recall the information, and when they went home that day they couldn't remember up to 20 to 80% of the information that they studied. So we went about a way to try and improve that, and with the increasing role of technology in medicine, it was only natural that we looked into the use of iPads or some kind of video assisted device that could improve the way that patients understood their procedure.
And how can that happen? How does video material help the patients?
So just like in simulation training for training urologists that we've seen at this conference, we looked into the way that we could deliver a video outlining a procedure, so the indication for the procedure, the risks, the benefits, the alternatives, all in a simple video that the patient could watch in their own time. Obviously the best way to study a procedure is a randomised control trial, so this is something that we performed back in Sydney, Australia, to look into whether it would be effective. And our outcomes that we looked at were patient satisfaction and patient knowledge, which are two important factors determining whether a patient judges that tool to be reliable.
Thorsten, how do you judge initiatives like this? Are they helpful?
I think they're gorgeous actually, and it basically fits together. When you think about these two projects, they fit together perfectly well. And I think as a society, we should offer to the patients actually and to the doctors the material to teach our patients, to inform our patients correctly. It's very important that we still have this consulting talk between patient and doctors, but the more informed the patient is and the more tools you have as a doctor, and that may be videos, that may be written, that may be spoken information, the more important and the easier this talk is, the easier the conversation is, because people start to understand each other.
And are there plans from the side of the EAU to provide more kind of those tools who would help patients to be better informed?
Definitely. On our homepage, right now we have 9 topics online covering 9 topics from the EAU guidelines, and by the end of 2016 we will be able to offer patient information on all topics tackled in the guidelines. So we'll have that information online, and it's well taken. We have over 125,000 visits on this homepage per month from patients. But of course in the future, and I think with the modern technology options we have, it's very important to also make the next step and go into a new media.
It was a pleasure talking to you both. Thank you very much for joining us.
Thank you.